Breast cancer occurs when there's an unusual change or mutation in the cells of the breast. Anybody, whether male or female, can develop breast cancer, although it is less common in males. BRCA stands for breast cancer. BRCA1 and BRCA2 are two types of genes that are linked to breast and ovarian cancer. The BRCA gene test requires a DNA sample that is gathered through a blood or saliva test. This is used to identify harmful changes in the BRCA1 or 2 genes. Someone who inherits the mutation carries a higher risk of developing breast or ovarian cancer. The estimated lifetime risk of developing breast cancer in a woman with one of these mutations is about 70%. The lifetime risk of developing ovarian cancer is 40% with a BRCA1 mutation and 20% with a BRCA2 mutation. Everyone should provide a thorough family history to their medical provider to determine if they are at risk of carrying one of these gene mutations. Women with a personal history or family history of breast or ovarian cancer may be candidates for BRCA testing. There are 3 possible BRCA gene testing results: positive, negative, or uncertain. A positive result does not mean the person will actually develop the cancer. If someone tests positive for BRCA1 or 2, this means that they are at higher than average risk of developing breast or ovarian cancer. This also means that there's a 50% chance of passing the mutation on to their children. A negative result indicates a BRCA gene mutation was not found. However, an individual with a strong family history of breast or ovarian cancer may still be at significant risk. Increased screening may still be recommended. An uncertain or ambiguous result sometimes occurs when a mutation in the BRCA1 or 2 gene is identified, but it has not been previously linked to cancer. If someone tests positive for a BRCA1 or 2 mutation, there are several options to decrease their lifetime risk of developing breast or ovarian cancer. All options should be discussed with your healthcare provider. Beginning at age 30 to 35, you can begin periodic screening with a blood test and a pelvic ultrasound. These tests may help detect ovarian cancer at an earlier and more curable stage. Once you have completed childbearing, or by age 40, removal of both ovaries and tubes is recommended to minimize your risk as much as possible. Beginning at age 25 or sooner based on family history, someone who tests positive should have a clinical breast exam every 6 months and a mammogram and a breast MRI once a year. BRCA2 carriers can reduce their risk of breast cancer by 60% by taking chemoprevention with a medication called tamoxifen. Surgery to remove the breasts can also be performed to decrease the risk of breast cancer by greater than 90%. The physicians at Magnolia Obstetrics and Gynecology are professionally trained to work with women who may have a BRCA1 or 2 mutation or who may be concerned with their risks. If you have questions or concerns, contact us to make an appointment.